Hi, thank you. My name is Michelle Hyde. I'm a board certified behavior analyst representing the California Consortium for Behavior Analysis. And I wanted, again, to echo the thank yous from everybody that was in line before me. I really appreciate all the hard work that went into the funding reform. I did want to mention a couple of things that weren't addressed that continue to plague providers of all types of services, including the 15% administrative cap that wasn't addressed in the recent reform. We would like to see that continue to be worked on. There was Assembly Bill 1565, which addressed that in a tiered system, which we supported, and continue to talk with Assemblyman Lackey about making roads on that. And then we also would like to see some work done with median rates. Median rates were passed in 2008, I believe, and they've really made a unlevel playing field. New providers are having trouble coming into service system, providing service at a median rate when vendors who have been around a little bit longer may be at higher rates. And so it's just a very discouraging situation with the median rate. So again, thank you very much. We still have work to do. Thank you.
That we do. Thank you. Next witness.
Hi. I'm Judy Mark. I'm the parent of a 19-year-old with autism, and I'm a volunteer with the Autism Society of Los Angeles, as well as the Partnership for Person-Centered Advocacy. I wanted to speak to the issue of racial and ethnic disparities in service delivery. It is really critical that we look at the families to provide us guidance on how to reduce these disparities. While cultural competency training is important, while having both the staff who provide the supportive services as well as regional center staff speak the language that the family speaks is essential and critical, that's not going to solve the problem. The problem is incredibly complex. The problem is you have a family who lives in Hawthorne who's provided services in Santa Monica, and they have no car. And they have to take the younger siblings to go to a social skills class 2.5 hours on buses in Santa Monica. And then they have to take them home, and the entire class is 1.5 hours. It's just not worth it to them, so they don't utilize the service. You have cultural issues where families don't trust strangers in their home. You have undocumented families who have a child with epilepsy who lives in a converted garage, and there's no nursing agency who's willing to provide the services. So the parents have to quit their job to provide 24-hour care for that child. These disparities are incredibly complex, and we have to drill down to what is the cause and how do we solve it using the families and their advocates. And so while spending these millions of dollars on cultural competency sounds great, it's not going to solve the problem. And so I would be happy as a family advocate working with many of these families in Los Angeles, and I know that there are others like me throughout the state. I would love to work with the department on this as well as the legislature. Thank you.
Thank you. Appreciate it. Next witness.
Hello, my name is Jackie Dillard-Foss with the California Supported Living Network. I wanted to start off with the sampling. I looked through the 2,000, I think the 1,800 providers that were part of the sampling for the rate increases. And what I saw, it was very interesting to me. See, supported living services, Harbor Regional Center had 4 providers who provide marginal supported living services, and Alta California Regional Center, which provides pretty intense supported living services, had a median rate provider and 1 SLS provider. So I think it didn't look like the sampling, so I am concerned. The outcome will be the outcome, but I am concerned about how the samplings were done, and were you really looking at, if you have an SLS agency at Harbor Regional Center that only is paid $500 a month, are you really going to get a true sampling of wage and benefits pass through? So that's one of my concerns. I did want to talk, obviously my life is about cultural disparity within the deaf community, and I have been doing that service since 1988. Not funded, there's no bilingual pay, there's no recognition of the cost of my agency to have interpreting services for my staff. They say that's part of my business choice, but I made a business decision to provide staff that could communicate with the families and the individuals supported. So we do need to see that it's not a regional center. The regional center case manager is critical, but they're not in, day out, day in, day out. So that's one. We really need to look at the community provider and my direct support professional that are bilingual, because you will see a great difference when someone has communication throughout their life and through the transition process. So I hope that's looked at. The other is I want to talk about the developmental center closure plan. This is what's going on with me currently. I'm having a lot of there's a lot of frustration. It is that it feels like there's 1,000 people getting platinum services. And I have just helped this young man, he's 6'3", 300 pounds with autism, homeless with his mother. Nothing is out there because he doesn't live in a developmental center. We need an enhanced community plan. We need to not say it's all about the developmental center. I've always said this. I will fight for someone getting psychiatric care, mental support care, dental, everything. Can we start talking about 300,000 people in the state of California that need an enhanced community plan? My friend Julian had nothing. 18 years old on the street with significant autism. It's not good enough, people. We need to start looking and thinking about our entire community. I will always say that till I'm out of this system, and I'll probably be 90 when I'm gone, but thank you.
Thank you. Okay, I want everyone to just take a quick pause and take a look at the agenda. So we are on issue 1 overview. Issue 2, closure of developmental centers. So the public comment now really should be focused on issue 1 and the presentation that was made, and we will get to all those other issues throughout the course of today's hearing. So if you would focus your comments on issue 1, I'd appreciate it.
Got it, Madam Chair. My name is Barry Giardini with the California Disability Services Association. First, I'd like to thank you and your fellow legislators for passing the funding bill. It is a huge breath of fresh air for our system. I want to note that although it's a large amount of money, it's not going to resolve all our problems. The funding within the funding package doesn't cover all costs for providers, so there are still gaps and things that we're going to be working towards and unfunded mandates that are pushing down on our system. But I also want to echo the sentiments of the earlier speakers about the $42.5 million coming out of the developmental or the community system to fund the developmental center audit. We believe it would be better placed keeping that in the community system. Thank you.
Madam Chair, Aaron Carruthers, Executive Director of the State Council on Developmental Disabilities. The department, during their overview, spoke about disparities, wanted to rise in support of the effort and the focus on disparities. Good news about this, or the bad news, is that it's not just a California problem. Every single one of my sister councils is working on the issue of disparities and how to reduce them. We have some, it is complex, as Autism Society of Los Angeles stated, but there's also some common sense solutions we feel that can go a long way. So we'll be joining with Disability Rights California and reaching out to the department as California is doing something that's not happening in many other states, which is knowing the issue, caring about it, and funding some solutions. Thank you.
Thank you very much on that. Appreciate it. Shall we move on to issue 2? Let's do that. Closure of developmental centers.
And just, if I could, would you like me to go through, there are a number of questions related to this particular item. Would you like me to go through all of them first, or pause and give you a chance to ask questions after each one?
I think let's try to go through all of them first. If I see colleagues hopping out of their seats, I might change the direction, but let's try to have you get through all of them first. Fair enough?
Understood.
All right.
The first item is just an overview of the proposals that we have related to the developmental center closures. So the first issue, the department is requesting $2.1 million. 1.8 million of that comes from the general fund. 8 new positions and 5 redirected existing vacant positions to support the closure of the 3 remaining developmental centers. The workload that closing all 3 concurrently has created for our headquarters office has been significant. The positions will be used to assist in things like the development of community facilities and consumer programs, supporting layoff activities at the developmental centers, resolving workers' compensation claims, doing things like handling payroll, accounting, fiscal reporting, and that becomes significant because as the populations decline, it becomes more difficult to retain administrative staff, so a lot of those functions shift to our headquarters office. The positions are also used to support information technology and working with families, advocates, consumers on the closure plan and getting the message out on that. The next proposal is related to our community placement plan funding, and the governor's budget proposes $146.6 million total funds. for the closure, for developing resources associated with the closure of all three developmental centers. The costs provide not only the resource, the total budget provides not only the resources to develop projects in the community and supports and services, but it also provides funding for the phase-in costs, moving people into community living, and a small amount for deflection, so ensuring that people don't end up in developmental centers. Of the total amount that's proposed, $24.5 million is proposed for Sonoma, $29.7 million for Fairview, and $24.6 million for the general treatment area at Porterville. And this is all in addition to the existing base of approximately $68 million for community placement projects. The next proposal we have is related to closure of various closure activities, and the budget is proposing a total of $18 million to support a number of smaller components. The largest of these is $15 million for to settle open workers' compensation claims. As I mentioned earlier, there's a benefit to the state in that if we settle these claims while the developmental center is still open, we're able to receive federal funding.
That's right, as we've learned.
Yeah.
Painfully.
The remaining funds are used for smaller but necessary activities at the developmental centers. We're proposing $500,000 to package inventory and transfer clinical records for all past and current residents to a central location. Funding the cost for the monitoring agreement that's required under the settlement agreement with the Centers for Medicare and Medicaid Services. So we've got $1 million budgeted for that, and then $1.5 million budgeted for the actual physical movement of individuals and their personal belongings from the developmental centers to their community living arrangements. There is also an item that talks about the change we're making in staffing at the developmental centers. We're projecting a total decrease of $8.8 million and 129.2 positions. Of this total, approximately half are level of care, the other half are non-level of care. And this is based on the population declining by approximately 188 residents. I think you know, it's one of the things that's important to note here is that when we prepare our developmental center estimate, we have typically used standard formulas because population has, and those formulas are tied to population, but because population has declined to a point where those formulas no longer work and that we have to keep minimum staffing requirements in order to meet licensing and certification requirements. So we're, Finance has been working with us on this, and we've, you know, we're kind of addressing issues as they arise to make sure we cover necessary staffing.
At some point, you hit a wall.
Exactly.
You have to have, for licensing, a certain level of staffing there. So we're not going to continue to see the significant decrease until we have complete closure.
Correct. Absolutely.
Got it.
Yep. And then the last issue is a spring finance letter proposal that we submitted for funding to assess the Sonoma Developmental Center property. The finance letter requests $2.2 million in general fund, and with that money, we expect to contract with Department of General Services, who in turn will contract with someone with a vendor with expertise in doing site assessments. The department redirected $190,000 of current year developmental center funding to begin the first phase of that assessment, because we believe that it's critical to have that assessment done so that we can speak intelligently with, you know, the county, with the parent association, with the legislature, with advocates on, you know, the condition of the property, where things are as far as the infrastructure, and the value of the property and things like that. So that's why we're requesting the funding for this assessment and hoping that it can begin next year. The next question asks about an overview of the Fairview and Porterville closure plans and how the plans differ from the Sonoma plan. And both the Fairview and Porterville plan are similar to Sonoma in that they identify the essential policies and strategies that we're going to need to achieve a safe and careful transition of people into the community. We, as with the Sonoma plan, the issues are the consumers that we serve, their health and safety, the employees that work at the centers, and then the disposition of the land. So these are the similarities, I think, that exist between the plans, that both these plans are focused in the same direction with the same priorities. The differences, I think, that are important to note is that the Fairview and Porterville plan contains a section on the safety net process. We know that's an issue of concern, not only a concern to the department, but to the community, to families. And so we're working on that process, working with stakeholders to ensure that appropriate and stable placements occur and that we're able to meet the needs of individuals who have challenging behaviors. The issue of the safety net is going to be the focus of the next Developmental Services Task Force that's scheduled for next week on the 13th. So that subject will be discussed there.
Your point is that these centers, they serve different populations. So it's because of the difference in the population.
Exactly, yeah. And that, we recognize that while the safety plan, we didn't have as much, we've been working on it obviously since we proposed the Sonoma plan, but at that time we didn't have as much detail as we have now, and that's why we've included it in the Fairview and Porterville plan. Another difference I think that is significant is the way the Fairview and Porterville property disposition process is going to be handled. With Sonoma, the administration understood the concern by the community, and the commitment was made to ensure that we work with the community on the best future use of the property. With Fairview, we know we've got some plans for it already. Obviously, Shannon's Mountain is one of the issues we're looking at there, and we're working forward on that. But I think that there's, given the location of Fairview, kind of in the heart of Costa Mesa, there's not quite the same concern about, what will happen. While there are some concerns as far as local concerns regarding development, there are some concerns in that area, but it's not the same type of issues when you're talking about 900 acres in the heart of the Sonoma Valley. But even though this process is going to be different in that, we're going to go through more like the standard surplus process with both Fairview and Porterville, we have met with both the cities and county representatives for Porterville and the city of Costa Mesa to, get their input on the plans, to get their ideas about what they think might work for their particular situations. And finally, the Sonoma plan made reference to the requirements that we have to meet under the settlement agreement that we negotiated with the Centers for Medicare and Medicaid Services. The Fairview and Porterville plans don't have that kind of detail because we haven't reached agreement yet. We are in the process of finalizing those agreements, and we expect to have those done relatively soon. The agenda then asks for an update on the discussions with CMS, and as as I just mentioned, while we don't have a settlement agreement yet, the funding, we did receive a letter from Department of Public Health that was approved by CMS to extend the funding from April 1st to April 15th. And as I said, our discussions, we're at the point, I think, where we're kind of doing some of the fine tuning. So we're hopeful that we will have reach agreements on both those centers relatively soon. Regarding the question of whether we received an update from CMS on the extension of the current year funding, we have not. We haven't heard anything further on that, but I'm sure as we get closer to year end, that'll be a discussion we'll be having. The next question asks how the department kind of synchronizes regional center project development with the transition of individuals into the community. And I think it's important to note that there's not exactly a direct correlation between the completion of the housing projects that the regional centers are working on and the transition of individuals into community living. One of the things that, while obviously housing is a critical component, the other thing that's very important is having the supports and services that are necessary to support that individual in place before they move. So, you know, we want to make sure that everything is ready when an individual transitions so to improve their chance of success in the community. So just wanted to point out that there's not, while we are seeing a lot of projects that will be completed in the spring and summer of this year, it doesn't necessarily mean that individuals are going to transition with the completion of those projects. For the current year from July 1st of 2015 through March 31st, we've had 124 placements out into the community. This is, we had projected we would get to about 202. So we're slightly behind, I think, where we would like to be. We have to place about an additional 78 between now and the end of the year to meet that. And again, it's these transitions and placements can sometimes move very quickly, and sometimes they can reverse course and things. So, but at this point, while we don't have final estimates of, you know, obviously it's too soon to tell where we're going to end up, we're hopeful that we're going to be a lot closer to the mark than where we are right now. And we think that with the assistance of the regional centers and community providers, we'll get there. There's also a question on what kind of coordination do we have with the regional centers, particularly at Sonoma, and the as I think we've mentioned previously, we've testified in previous hearings that there is a group that we work with each regional center on a monthly basis. We have conference calls and walk through the resources they're developing, the status of the individuals they're proposing to transition into the community, and we make sure that we keep up with that information on a month-to-month basis. We're also working with the families of each resident to ensure, excuse me, that transition is proceeding as planned, and that families are comfortable that the needs of their loved ones are being met. And then the agenda also asked, is the issue came up at the February 23rd joint hearing that there was an issue on regarding the need to pay for beds that are on hold. The community placement plan startup funding that's requested by regional centers and approved by the department can be used for the cost of getting these homes up and operating. Excuse me, startup funding can be used for hiring, can be used for training staff, purchasing accommodations for a residential home, any adaptations that are needed to serve the consumers, and the costs associated with any ramp-up period for starting new services. Service providers can also use startup funding to cover their costs during the initial period of service provision when consumers are transitioning into the home. And the cost may be used to cover, or the funding may be used to cover any costs incurred as a result of transitions taking longer than expected. So if a service provider is experiencing unanticipated delays in reaching full capacity at the home, and the regional center agrees that additional startup funding is warranted, they can contact the department and work with us through those issues to make sure that there is sufficient funding to continue operation until residents arrive. And when we receive these kinds of requests, obviously, we look at them on a case-by-case basis and determine them based on their individual merit. The next question was an update on the community crisis capacity development and placements of last resort. And throughout the state, we're currently developing 20 enhanced behavioral support homes, which, as you're aware, are expected to provide assistance to individuals who have challenging behavioral needs. We expect a capacity of 80 homes. With the current funding that we have, we expect to build out 80 of those enhanced behavioral support homes. And we're also working on community crisis homes. While we are still working on the regulations for the community crisis homes, we're moving forward with the development of the projects, assuming we will get the regulations in place sometime this year. So right now there are 6 community crisis homes and that have a projected capacity of 24 individuals. We're expecting that regional centers are going to propose additional crisis homes as part of the 2016-17 plan. And we're looking at the types of services and the intensive needs that individuals in these homes have to ensure that the appropriate services are being provided. While we don't have a definitive timeline yet for when, obviously when these homes will be developed, because like a lot of the homes, it's a process that we have to work through. The next question was to provide an update on the plan for ensuring that specialized medical services exist in the community. And regional centers are in the process of developing a variety of services right now. A few of the regional centers involved in the Sonoma closure are looking at developing dental services that would include both mobile and office services. All 6 of the Sonoma developmental centers, all 6 of the Sonoma regional centers are collaborating on a medical model that trains medical personnel in the community to better inform them of how to deal with individuals who have developmental disabilities and are transitioning into community services. And we're also looking at services related to psychiatric and psychological issues. So, the agenda asks for an update on the possibility of retention bonuses and state service credit opportunities for developmental center employees. And the department appreciates the urgency of this. I mean, we, as with all 3 centers closing, we are concerned, and we know that people are out looking for jobs, and it is important to get retention proposals in place to assure that individuals who are interested in remaining at the developmental centers through closure have some incentive to do so. So to that end, we've been working with the California Department of Human Resources and with the Department of Finance on ways to achieve that. And we're looking at things like not only retention proposals for existing employees, but recruitment bonuses for new employees, because again, you know, we have to keep staff at appropriate levels at the developmental centers as we move forward. And, you know, we're looking at other incentives that may be attractive to employees. So those are things that, and I know the agenda is looking for a timeline, and, with, this is part of the deliberative budget process and the bargaining unit process, and it will be, while I can't provide you with a specific timeline right now, it's obviously an issue that we are very aware of and are working diligently on, so.
Can you give me a general sense? I mean, because from our perspective, the reason we asked the question about timelines is just having a sense of, I think the general public wants to know, and if this is I just think it's important that we all are clear generally where you are in the process and what goal it is you're aiming for. So I'm assuming this budget cycle? No?
Well, we understand the immediacy of the issue, and so, yeah, as I think it's probably a reasonable assumption, but again, we're working through all this.
This budget cycle?